There is an addition to the HRT preparation from the British Menopausal Society. Yes, Drospirenone, which is an oral contraceptive that does not contain any estrogen and has the hormone Drospirenone, which is a progestin. The brand name for this is Slynd and is listed on the British Menopausal Society list of suggested alternative to licensed HRT products such as the Mirena coil, Utrogestan, Provera, and norethistron in the case of progesterone intolerance. So if you have progesterone intolerance, and this is a new addition that we can try. So you can take the progesterone tablets, so Slynd, continuously, omitting the pill-free interval. Therefore, this combination is for postmenopausal women who have a womb and need continuous combined HRT. We wouldn't recommend using Slynd at the moment for women who are, say, perimenopausal and need a cyclical or sequential HRT. You're probably thinking, hang on a minute, I've heard of Drospirenone before. Isn't it what was used in the birth control pills such as Yasmin? And yes, you would be absolutely correct. This medication can also be used as a contraceptive as well. Okay, we know it can work well as a contraceptive and as part of the HRT for endometrial protection if you are in the need for continuous combined regime. So here are the benefits. Firstly, there's no impacts on clots, no increased risk of stroke, and no increased risk of breast cancer. It doesn't seem to increase the risk of weight, and unlike other synthetic progestin, it doesn't seem to cause any worsening of, say, acne or worsening PMS or anxiety-type symptoms. So yes, it works really well if you're intolerant or have progesterone intolerance to, say, the usual types of progesterones that we would need to use as part of your HRT for endometrial protection. But as always, there is a catch, and there are some side effects associated with Slynd, such as nausea, breast tenderness, mild headaches, fluid retention. You can get changes to your vaginal bleeding, so it could become heavier. And we still don't know if there's a link with bone loss. Now, the data shows it might not be associated, but we are unsure. And Slynd's own website mentions high potassium levels and says, check with your healthcare provider for potassium levels in your blood before and during treatment with Slynd. So actually the jury's out on whether Slynd causes overall in the long run any bone loss. However, if you're replacing with Slynd estrogen, then the idea is that it counterbalances that, and therefore the estrogen component of your HRT will provide you with your protection for your bones. So as always, each medications that we offer will come with its own risks versus benefits. On the one hand, Slynd is a good option if you are progesterone intolerant with your traditional HRT options and if you want to use it as a contraception. So it makes it as a suitable option for some women who wish or need to have an avoidance of estrogen. It also comes down to looking at your own individual risks and options. So always chat to your doctor. But as always, if there's any questions, please leave them below and I'll try and answer as many as possible.